Hi, my name is Elaine Clark and I'm a registered dietitian working at St. Joseph's Health Center. And for Nutrition Month, we received a few questions through Twitter. So is gluten-free or wheat-free the way to go for people with a moderate intolerance? So confused with the popularity of gluten-free. The gluten-free diet is definitely on the rise, and although there are some people who need a gluten-free diet, it's definitely not necessary for everyone. So what is gluten? Gluten is the protein that you find in wheat and some other grains such as rye and barley. And for people with a condition called celiac disease, they need to completely and totally avoid all gluten-containing foods. And that's because when they eat gluten, it causes inflammation in their intestines, and that leads to malabsorption of nutrients and minerals. People with celiac disease may experience symptoms like weight loss, abdominal pain, diarrhea, or fatigue, but oftentimes they don't have any symptoms at all. There's also another condition called non-celiac gluten intolerance, and the symptoms to this can be very similar, mimic those of celiac disease. They may also have other symptoms such as head fogs or headache or bloating when they eat gluten-containing foods. And for these people, avoiding or minimizing gluten may be beneficial to help to relieve their symptoms. But before you go and take gluten out of your diet, you really need to be tested to rule out celiac disease. And for the testing for this, you need to be eating gluten. And the reason why this is such an important step is because celiac disease is a serious condition where the person who has it really needs to be followed by a team, including a doctor or gastroenterologist and a registered dietitian. So once you've had the test, you find you don't have celiac disease, you can feel free to reduce or remove gluten in varying degrees from your diet to see if it helps to relieve your symptoms. And if it does, you'd be someone who'd benefit from following a gluten-free or reduced gluten diet. But gluten-free doesn't necessarily mean healthier, and a lot of the times processed starches and flours are used in place of whole grains. So if you do need to follow a gluten-free diet, make sure you're choosing whole grains such as wild or brown rice, quinoa, buckwheat, or teff, and that'll make sure that your gluten-free alternatives are also healthy choices.